Throughout Black History Month, we continue highlighting the racial disparities in society which remain drivers of inequity. This week, we're focusing on healthcare, and as you're about to see, institutional racism and other factors can create differing health outcomes for Black and white Americans.
Let's start with the diabetes debate. Diabetes is a leading cause of illness and death in the U.S., but a study published in the Journal of Urban Health compared disparities in diabetes mortality across the largest U.S. cities. Study confirmed Blacks are dying at a higher rate from diabetes than whites in virtually every major city in the nation. Researchers found economic inequality had the greatest impact on the disparity, followed by segregation. Other factors driving the disparity included lack of access to healthy foods and safe spaces for physical activity. Let's move on to infant mortality. This is data from the U.S. Department of Health and Human Services Office of Minority Health. It shows Blacks have 2.3 times the infant mortality rate as whites. Black infants are 3.8 times as likely to die from complications related to low birth weight as compared to white infants. And in 2017, Black mothers were 2.3 times more likely than white mothers to receive late or no prenatal care.